Today's video is going to about how to write a nursing care plan. All the nurses need to know how to write a nursing care plan before providing any care to a patient. So, what is nursing care plan? Nursing care plan is the pillar of nursing care. So, as a nurse, before providing any care to a patient, the nurse must know how to formulate a nursing care plan. So, nursing care plan provides direction on the type of a nursing care. Means the nursing care plan provides the direction of patient care to the individual, to the patient, to the individual or family or in a or for a community. So, nursing care plan basically provides the route or direction to a nurse or type of nursing care is needed for the family or community or a individual patient to meet their needs. So it is basically a systematic way to provide care to a patient or client according to their needs or priorities. So the goals of nursing care plan. So to provide continuity of care, quality of care to a patient, to provide continuous care and to provide a better or quality care to a patient, we need to formulate nursing care plan. Next is to maintain records of nursing care of a patient. So nursing care plan maintains a record, whole record, that is from the assessment, from the starting to the ending of a patient care is maintains the records of a patient ultimate care. It is recorded by the nursing care plan. And third point is to provide systematic and proper care to the patient. So next come to the components or elements of nursing care, or it may be you called steps of nursing care. Same steps, components, elements are same, that is assessment, nursing diagnosis, goal, planning, intervention, implementation and evaluation. So first come to the assessment phase. So you all know from the term that is assessment means to assess, the verb is assess. So the assessment phase is the first step, and in this step critical thinking skills and data collection is done in this step. So in this assessment step, critical thinking process of the nurse is needed and data collection from the patient or the caregiver, it may be patient family member. The data collection is done in this assessment phase. So two types of data collection are done, that is subjective and objective. The subjective data involves mainly the verbal statements from the patient, and objective data is the measurement of the patient vital statistics. Means the objective data is measurable, which is observed or measured by the nurse. As for example, vital signs, height, weight, etc. So the subjective data involves, or subjective data is the patient's statement, patient's verbal statements. In case of patient, if the patient is unconscious, then the caregiver or the family member gives this subjective data. We take these subjective data from the patient caregiver. That can be the family member, that can be the caregiver of the patient. So that is the subjective data, which the patient or the subject verbalize to the nurse. This is the subjective data. And the objective data is the objective, means it comes from observe. The nurse observed from the patient and get the information, and the objective data is measured by the nurse. As for example, I told you that vital signs, It can be height, it can be weight, etc. Next, come to the next step or component, that is nursing diagnosis. So after the assessment phase, then we come to the nursing diagnosis phase. So by the assessment, we get the information, we gathered the information, it from the patient itself, patient verbalization, or by the assessment, or by the observation, by the measurement, we got the information or data. And after getting data, the nursing diagnosis is the second step. It is developed by the data collection and obtained from the data collection of the patient informations or patient uh, measurement. We finalize, or we formulate a nursing diagnosis. So from the assessment phase, we identify the problems, and according to that problem, we formulate the nursing diagnosis. So basically, nursing diagnosis is formed mainly with the need or problem, main problem. It focuses on the main problem of the patient. So in nursing diagnosis, we formulate nursing diagnosis on the basis of, on the focused on the patient's genuine problem. So nursing diagnosis focuses on the patient's genuine problem. So next step is the goal. After formulation of nursing diagnosis, we formulate the goal. We fix the goal. The nurse fix the goal. In the goal step, after formulating nursing diagnosis, then goal should be fixed to solve the problem. So in assessment phase, we gather the data, and whereas we identify the problem and formulate nursing diagnosis. And after formulation of nursing diagnosis, we fix the goal. Not necessary in the nursing care plan. In everyday life, we always fix our future goal. Same thing we done in nursing care plan. After assessing the problem, we fix the goal, that is, in future or after providing care, the patient's problem will be reduced. So in goal, we formulate, or we fix that after providing care, or after giving actions, or solve the problem of the patient, is it reduce the problem or not. So we decide, we fix our goal by assessment, and after formulating nursing diagnosis, the nurse should fix the goal. After that, the next step is, or the next component is planning intervention. In planning intervention step, the nurse planned for solving the needs of the patient. So after fixing goal, that is, the problem of the patient should be reduced, or problem of the patient should be fixed. So in planning intervention phase, the nurse planned the actions, means that particular problem of the patient. To solve the problem, what are the actions the nurse should be planned, or what are the actions the nurse should be performed to solve that problem, or to solve the needs of the patient, what are the actions the nurse should be performed, or what type of care is needed to solve this problem, the nurse is planning or planned in this phase. After that, that is implementation phase. In implementation phase, in this phase, here the nurse performed that actions in reality. So in planning phase, just nurse planned it in her mind, but in implementation phase, the nurse doing it in reality. The actions which the nurse planned in planning phase, that actions are actually done or actually performed by the nurse in implementation phase. It is in this phase the nurse actually performed this activity, or care or actions in on the patient. And last phase, that is evaluation phase. In evaluation phase, it is the last phase. In this step, after doing these actions or the care which is provided by the nurse in implementation phase, is these actions or care is actually work or not, is the nurse's work or care or actions actually working on the patient or not, is the problem of the patient is reduced or not. Means it is the evaluation phase is the reassessment phase. After providing care, after providing work, after providing actions on the patient, after providing care to the patient, the nurses reassess the patient, is the problem of the patient is reduced or not, is her activity or actions are working or not. So in this process or in this nursing care plan process, nurse makes nursing care plan by maintaining those 6 steps, that is assessment, nursing diagnosis, goal, planning, intervention, implementation and evaluation. So those 6 steps are necessary to maintain a nursing care plan or to provide proper care to a patient. We have to follow the nursing care plan and that 6 steps or components of nursing care plan.